On this week's 51%, we hear from physician coach Dr. Gail Gazelle about how healthcare workers can use mindfulness to find strength and combat burnout amid a strained healthcare system.
What can you do to thrive in your career? Don't hand over your happiness to a dysfunctional healthcare system.
We also speak with researchers at the University at Albany about how providers can alleviate the healthcare worker shortage in New York State. I'm Jesse King. It's all up next on 51%.
I was standing around like one of those girls I had seen in a movie. The whole world was a movie back then. I had my sunglasses on, I wanted to be seen without seeing shy Lolita. I wasn't really in it, I didn't really get it.
You're listening to 51%, a WAMC production dedicated to women's issues and experiences. Thanks for joining us. I'm Jesse King. Today we're talking about burnout and staffing shortages, particularly among healthcare workers. The Bureau of Labor Statistics says there were more than 16.4 million women in the healthcare and social assistance industries in 2021. And while we don't personally have the answers for many of the issues that plague the system, we did speak with some experts who had some ideas of their own. We'll start in New York with a string of recent reports by the University at Albany's Center for Health Workforce Studies. Most recently, the CHWS took a look at what it feels could be an important remedy and found that the number of New York providers participating in service-obligated programs increased 33% between 2020 and 2022. Service-obligated programs are essentially what they sound like. Healthcare workers, many of them recent graduates, agree to work in an underserved area for a certain period of time in return for some sort of incentive, like loan repayment or a J-1 visa waiver. Director Gene Moore says New York actually has an abundant supply of healthcare workers, but they're not evenly distributed, leaving providers in inner cities and rural areas in a vulnerable spot. Moore says service-obligated programs are often set up by the state or federal government, and the CHWS has historically worked with New York to identify shortage areas across three key sectors: primary care providers, oral health, and behavioral health. And while something like service-obligated programs might be seen as an emergency measure, Moore says increased usage of them could work wonders for the state.
It's important to monitor the programs to make sure that they're actually being used. And by the way, one of the things I want to say is that we survey residents completing training every year who train in New York. And if they're leaving New York, we say, why are you leaving? Where are you going? And one of the answers we hear a lot is proximity to family. I came here to train, and now I'm going home. Which makes me wonder, hey, if we trained more people who are from New York, would we do a better job of retaining them? And by the way, if we recruited them from underserved communities, are they likely to go back? You know, if somebody stays in an area for 6 years, is it possible they lay down roots and stick around?
Robert Martiniano, Senior Program Manager at CHWS and the lead author on the report, says roughly 2,000 providers in New York are currently participating in service-obligated programs. In addition to the state's uneven distribution of workers, Moore says providers are struggling to recruit and retain high-functioning employees, especially nurses, counselors, hygienists, and dental assistants. Now, they both say the strain on New York's healthcare system has been a long-time problem. This wasn't something caused by the sheer workload and trauma induced by the COVID-19 pandemic, but it certainly didn't help. Moore notes a lot of nursing students were barred from in-person training during the pandemic, relying instead on virtual training, only to feel completely unprepared and overwhelmed once they stepped into the workplace. Martiniano says the increased use of nurse residency programs might help on that front.
A number of hospitals have started nursing residency programs where they come in, they work for a year on whatever unit they work on, but they also have mentors. They also have, weekly meetings to talk about the issues. So while they're doing hands-on bedside care, they're also kind of learning the ropes more.
As it happens, though, part of the state's nursing shortage is somewhat self-inflicted. Martiniano says a recent CHWS study found an increasing number of faculty retirements left some New York schools with no choice but to reduce the number of students they admitted to their programs or training slots. When you admit less students, naturally, you graduate less students, exacerbating staffing shortages that, in turn, are burning nurses out and contributing to high turnover rates. Moore says many providers increased their reliance on travel nurses during the pandemic. That's different from service-obligated programs in that nurses are being paid higher rates to leave their families and work in shortage areas, typically for just weeks or months at a time. But now that the pandemic is largely over, that method is causing more friction than relief.
At times, you'd see staff, say at a hospital, working alongside travelers who were earning a whole lot more than them and found it pretty demoralizing.
Bertiniano ultimately says that fixing the problem is going to require administrators to come to the table and hear workers out. Bertiniano says a lot of working parents became burned out trying to juggle work and home life during the pandemic. And by giving workers more control over their schedules, providers might be able to alleviate some of that stress and thus retain workers. Moore also notes that workers who feel listened to and empowered are more likely to stay.
One needs to pay attention to kind of the sense of well-being that staff have. One of the things, last year we were doing a study of workforce shortages in New York City, and one of the people we talked to talked about adding a retention coordinator to the HR department. Talk to staff, take a pulse, find out how they were feeling, what their issues were, and the extent to which they could do something about it.
The CHWS is part of the University at Albany's School of Public Health. You can read more of their reports on service-obligated programs and the nursing shortage at chwsny.org. While there are a lot of ways providers can alleviate the strain on healthcare workers, our main guest today doesn't want burned-out physicians and nurses waiting for the system to fix itself. Dr. Gail Gazelle is a physician coach and part-time associate professor of medicine at Harvard Medical School. Her new book is Mindful MD, 6 Ways Mindfulness Restores Your Autonomy and Cures Healthcare Burnout. A certified mindfulness coach who has helped more than 500 physicians, Gazelle says treating healthcare worker burnout on the personal level is vital to workers, the healthcare system, and of course, the patient. Her book tries to help healthcare workers steady and re-energize themselves by reducing reactivity to outside stressors. She spoke with our associate producer, Jody Cowan.
It's when we lose our passion, we lose our sense of meaning. We walk around exhausted, even if we've been able to get a good night's sleep, and we become very cynical. We wonder to ourselves, what am I even doing here? How much good am I doing? In other words, we lose connection with everything that we're accomplishing as a physician, which is a lot for any physician. And we're seeing very high levels of burnout. Studies are demonstrating 1 in 2, 2 in 3 physicians, huge numbers in every possible specialty. And very tragically, that's leading to disconnection with patients, not going the mile for a patient as we would have before. It's leading to medical errors. And it's leading to physicians leaving the field. And we're going to have a big shortage of physicians. It's estimated 100 to 150,000 shortage in the next 5 years. And that is actually a very concerning phenomenon for all of us.
What is it that's typically causing this burnout? Is this something that's an individual situation or systemic? What are the roots of some of these causes?
It's such a great question, and it's really multifactorial. We've seen a sea change in healthcare to physicians moving from being practitioners in their own independent office to physicians being employed, and they're employed by large corporate entities. And when you're an employee, you have a lot less autonomy over the conditions of your job. So physicians are being told how many patients they'll see, how many rooms they'll get to see those patients in the office suite. They're being told that they have to get their charts done in a certain cadence. And in addition to that, there are a lot of tasks now that end up on the physician's desk, such as having to haggle with an insurance company, maybe to spend hours on the phone with an insurance company just to get the okay for a test that your patient vitally needs. So physicians are being forced to do what we might call below grade tasks, and that erodes their ability to actually have time to be with their patients. And so that's one big factor. What I talk about in the book, Mindful MD, is that there are also a lot of things that we learn in our training that I believe set us up for burnout. We learn that if we're not perfect, we're a failure. We learn to compare ourselves to our peers, not to focus on where we're doing well, but to focus on where we're coming up short. We learn to be a kind of the invulnerable captain of the team who never shows weakness and always has the right answer, even in the early period of a pandemic when nobody had a right answer. So I see that as a big factor. It sets us up for not being able to trust ourselves, not being able to feel confident and good about what it is that we do as physicians.
And what's happening to the individual worker, the physician, when they're feeling burnt out? And how does this affect both them and the patient?
The impact is mighty, and we physicians are always worried about malpractice suits, right? We live in a litigious society, and we all know that physicians could be the target of lawsuits. And we're always worried about stigma. So, a lot of physicians, let's say they're struggling with depression, they might be very reticent to see a psychiatrist, and they might be even more reticent to go on an antidepressant medication because, heaven forbid, they should be the target of a malpractice suit that could be used against them. So there's a lot of stigma to seeking help. And that is very unfortunate because physicians are human beings. And they're human beings who work incredibly hard in the service of helping vulnerable citizens live their best life, recover their health physically and mentally so that they can reach their full potential. But that's a stressful job, right? That's an emotionally laden job. And if you think about the pandemic, physicians were on the front lines, not being able to save people, not being able to meet their professional duties, seeing body bags. And so physicians need to be able to access services, not just for depression and anxiety, but so that they can thrive in their careers. And that's been something that unfortunately has left physicians struggling with burnout because they're afraid to seek help. Coaching is a great alternative, for somebody that doesn't have, really true mental difficulties because coaching doesn't carry that same stigma. And that's really important because physicians can feel safer seeking a coach, and that can be tremendously helpful in recovering their sense of meaning and purpose so they can be there for the patients that they truly care deeply about.
I'm interested now to hear about your approach to easing some of these burnout symptoms and really looking at the mindfulness of looking at this.
Well, it's so interesting. When people hear the word mindfulness, they often picture monks meditating on the mountaintop or, hippies coming out of Woodstock. But mindfulness is something very deeply important for all of us. It's really an operating manual for the instrument that we all use in all our waking hours, the human mind. And this is critically important because as physicians, we don't learn how to question our own thoughts, our own stories. And just for your listeners, if you spend 2 hours in your day today just paying attention to your own thoughts, it really doesn't take long to see how many of our thoughts are not helpful. Their worries, their fears, their ruminations, their internal arguments, criticism, judgment, etc. And they're not necessarily helping us. They're not helping us feel better about ourselves. They're not helping us interact more productively with those around us. They're not helping us reach our potential in contributing our skills and talents to the world and the communities around us. So, mindfulness is about being aware of what your mind is up to so that you can regulate yourself. And this is critically important for physicians because we get caught in a lot of unhelpful thoughts and stories. We also get caught in a lot of patterns of emotional reactivity. And very tragically, we don't learn in our medical training how to manage our own emotions. And a lot of emotions come up for a doctor. We're doing difficult things, we're giving difficult news. We have incurable diseases that we have to explain to patients, right? We see patients die. We see young children developing cancers. A lot of emotions arise. So, to me, we have to start early in medical school and residency training, helping to equip physicians to utilize their minds so that they can self manage everything that arises for them.
Using your approach to recognizing and dealing with this, is the information that's in your book different than the workshops that you're doing in your coaching practice?
The book really follows on what I've learned over the last 13 years, coaching well over 500 physicians and physician leaders. The book includes a lot of stories because those stories help take mindfulness from this esoteric idea, oh, she's going to just tell me to go meditate and life will be wonderful. It takes it from that to something very practical. Let's look at in the day-to-day life of physicians just like you, or nurses, or really any of us, because a lot of people have read my book who are not in healthcare and told me that they found it tremendously helpful. So we're really, it's an easy read, Mindful MD, and it really helps people see, well, what's in it for me? To adopt this mindfulness approach, to actually get to know the workings of my own mind. How is that going to help me? How's it going to help me in my career? But very importantly, how is it going to help me be the person I want to be with my family, for example, in my church community, wherever I show up? That's what I'm really excited about in presenting Mindful MD to the public.
And you mentioned there's 6 ways to restore autonomy and to cure burnout here. Can you give us some insight into one or a few of these ways that you're looking to introduce us to?
Well, let me start by saying that none of the 6 ways have the word meditation in them. So the first way is recognizing that you are not your thoughts. The second is stepping out of mental stories. So those two are very closely related. We in healthcare learn that the mind is all powerful. We don't learn that our thoughts are not necessarily always helpful. Stories are simply the amalgamation of all of those thoughts. So the first 2 ways really help us begin to understand the ways that our mind is helping us and the ways that our mind is perhaps derailing us and contributing to our burnout. The third way is reducing reactivity, really getting to know our own emotional weather systems. Why? So that we can work with them with more agility. The fourth way is leaning into compassion, connection, and purpose. Really at the heart of the fabric of healthcare, compassion, connection, and purpose. But we lose that when we're in burnout. The fifth way is working with what is. We all wish the healthcare system would be more human centric, less focused on the bottom line, but we have to work with the healthcare system that we're in and not kind of beat our heads against the wall of the health system that does not exist because we dissipate precious energy that we can't afford to lose. The sixth way, which really builds on the other 5, is cultivating upward spirals. When we're in burnout, we are on a downward path, a downward spiral. We have to pause that downward cycle. And with mindfulness, we move to an upward cycle where we're thriving more. We're seeing the good in ourselves and others. We're contributing. We're aligned with our sense of meaning and purpose. We're alive. We're thriving. Really the opposite of burnout.
Would you consider the way that you're approaching treating these symptoms and addressing them as an alternative approach to how maybe this is commonly treated or how this is commonly looked at the moment?
I think that's a controversial question, but what I can say is that it is a successful approach. So, what I've seen again in the hundreds of physicians that I've had the privilege of coaching is the power that these 6 ways have to get out of our own way, in a sense, and allow us to reclaim the passion that every physician entered medical training with.
Yeah, and I would imagine that some of these folks, maybe with a little bit of ego involved, have maybe some difficulty getting out of their own mental way. Has there been pushback to this inward looking?
I think that's a very good point because everybody in healthcare knows that the healthcare system has taken a beating, right? The pandemic made that very clear. All of the health disparities that we really came to see during the pandemic, all of the under-resourcing, the fact that healthcare in the United States has become a big business, just like other big businesses. And what are big businesses focused on? Well, they're focused on the bottom line and productivity and profit. So it's all too easy for people in healthcare to kind of sit back and say, well, don't ask us to do anything, fix the system. And of course, system improvements need to be made. There's no question about that. But what I counter that with is, well, are they going to be made next week? Are they going to be made next month? Are they going to be changed? Are systems going to improve in the healthcare environment in the next year? And I think that's a really important question because what I'm all about as a mindfulness educator and as a coach is pragmatic solutions. And what I want people in healthcare to really be thinking about is what can you do to thrive in your career? Don't just sit around and wait, and don't hand over your happiness to a dysfunctional healthcare system.
What is it that folks can look for as far as the early signs of burnout or potentially addressing it before it gets the full-blown downward spiral that we're talking about?
Early intervention is key. Just like with any disease, we want to take a preventative approach. And I'm delighted that I've been asked to give a series of workshops to the incoming class at my institution, Harvard Medical School, because there's a recognition that we have to start very early. Tragically, rates of burnout in medical students are not low. These are things that medical students develop early on. We have to take a preventive approach. And so, and I just came back. I was in Chicago teaching in the American Medical Association, coaching in medical education course. So medical schools across our country are investing in developing coaching programs for their students. This is such a positive trend because it can help set the stage for students to grow and learn, to step out of that type of model that if you're not perfect, you're a failure, to step out of the seeds of the imposter syndrome that often develop because of that rubric, to learn how to be kind to themselves, to bring the same caring to themselves that they bring to their patients, to learn how to care for themselves, to not run on empty. There's so many things that we can be helping medical students do, and I think we really have a duty to do so.
You touched on the distinction a little bit before. Does healthcare worker burnout affect everyone in the field, as from the nurse to the doctors to the lab technicians equally?
There are a lot of studies now demonstrating very high levels of burnout in physicians and in nurses. With the great resignation that we've seen over the latter part of the pandemic, we're in a dire shortage, not just of physicians, but of nurses, of technicians, of OR technicians, of certified nurse anesthetists, of therapists, even janitors in hospitals. And this is a dire situation. If you or your loved one, anyone listening to this program, is in need of healthcare, who has to be hospitalized, can you imagine, your surgeon going to the operating room and not having the staff that they need to give your loved one the best possible surgical treatment? But that's what we're facing in this country. So this is a massive public health issue. And the good news is I'm not the only one crying this from the rooftops. Every major professional organization in healthcare recognizes the need to stem the tide of early retirement and attrition in all levels in healthcare. This is really a public health emergency in a sense. So we can all contribute to the well-being of healthcare workers by being kind to them, by showing recognition for the good that they do, by supporting them. Obviously, they're there to support the patients, but patients, I think, also have a role in this, just to acknowledge how hard the job is of a physician. If your physician is running 20 minutes late, to actually realize that's because they have an overbooked schedule and they have to be, again, on the phone, trying to get a wheelchair for an elderly patient or trying to get an MRI for somebody who's having, horrible headaches. It's not because they're at fault. It's because they're kind of a cog in the wheel of a very complicated healthcare system.
Any advice for the average person that doesn't work in healthcare but maybe feels burnout and is looking for ways to address these spirals?
It's a great question because levels of burnout are not just high in healthcare. They're high in public service. They're high in the field of education. They're high for lawyers and probably many, many other areas. And so there are a couple of things. Well, I want to just say, first of all, that my book is applicable, not just in healthcare. Mindful MD, 6 ways mindfulness restores your autonomy and cures burnout, period. Because with mindfulness, we realize that we can take charge of our own lives. We don't have to be on autopilot. We have a lot more choice in every situation we find ourselves in, and we don't always realize that on our own. Further, I think that self-compassion is somewhat underrated in American society. So when we're burnt out, we start judging ourselves. What's wrong with me? What's it that I can't keep up in my career? Everybody else seems to be doing well. Why can't I? If I were a better teacher, journalist, doctor, fill in the blank, I wouldn't be burnt out. So we kind of insult upon injury, right? And with mindfulness, we become aware that we're doing that. And we also become aware of just how deleterious it is, just how unhelpful it is for ourselves. And once we realize that, we realize we don't have to go down that route. we can actually be kinder to ourselves. We can say things to ourselves that we would say to a loved one or a good friend. Gosh, what I'm going through is hard, and I'm doing the best I can. So self-compassion is a very powerful medicine. So those are just a couple of quick tips.
That was Dr. Gail Gazelle. Her new book is Mindful MD, 6 Ways Mindfulness Restores Your Autonomy and Cures Healthcare Burnout. She spoke with our associate producer, Jody Cowan. To learn more about her work and check out the book, you can go to her website. That's gailgazelle.com. We're going to switch gears before we go to discuss workers in another field, academia. Recently, a group of professors filed a class action lawsuit against Vassar College, alleging the historically women's college knowingly failed to address a gender pay gap among its faculty. The plaintiffs are 5 full-time women professors teaching subjects from physics to film who say the college in Poughkeepsie has for years systemically underpaid, underpromoted, and unfairly evaluated its female professors. Law firm Leaf Cabraser, Hyman, and Bernstein and equal rights advocates filed the class action gender discrimination lawsuit in the U.S. District Court for the Southern District of New York on their behalf. Melvina Ford is the National Legal Director at Equal Rights Advocates. She says the pay gap between full-time male and female professors was around 10% in the 2020 to 2021 academic year, with men on average making $153,238 and women on average making $139,322.
The university, at the insistence of the professors, did a study in the 2020-21 year that actually showed for the longest serving post-tenure professors, the gap was getting closer to 20%.
In a statement posted on Vassar's website, college president Elizabeth Bradley says the college is limited in what it can say on the matter, citing the pending litigation. Vassar Board of Trustees Chair Anthony Friscia shared his regret over the situation, adding the college has been working with the group, quote, diligently and continuously on the issue of pay equity, end quote, since January 2019, and proactively sharing its analyses on the subject. Ford says the plaintiffs allege they've been trying to resolve the issue for at least 15 years, and the college has recently gotten less transparent about its salaries.
They used to disclose the mean and median salaries at each of the professional ranks, and they're no longer doing that. So in addition to equalizing the salaries, the professors want Vassar to make faculty salary ranges and scales public, so there's more transparency about what people are being paid. They want Vassar to establish clear guidelines for performance and evaluation and for promotions, and they want Vassar to engage an independent body to actually facilitate faculty salary negotiations and service expectations.
Founded in 1861 by Matthew Vassar, Vassar College was just the second institution to grant degrees to women in the U.S., behind Mount Holyoke College. It's part of the Seven Sisters, a group of 7 liberal arts colleges historically founded to serve women, even though it eventually became a co-ed school in 1969. The gender pay gap at Vassar, following Ford's figures, is smaller than the nationwide average. According to the U.S. Department of Labor, women working full-time, year-round in 2021 earned 84 cents for every dollar men made in similar positions, and that 16% gap widens for older women and women of color. Vassar's pay gap may also be lower than the average pay gap at many schools. In its annual faculty compensation survey for the 2022 to 2023 academic year, the American Association of University Professors found full female professors across roughly 900 institutions received about 82.3% of what their male peers made. Nearly every industry is facing a gender pay gap, but Ford says the difference here is Vassar's history.
Its origin story is about ensuring equity between men and women. And if it can happen at an institution like Vassar, it can happen anywhere. And it just demonstrates how pervasive this gender pay problem is.
In his statement, Board Chair Friscia expressed Vassar's desire to resolve the issue, adding it will, quote, continue working to resolve this disagreement with these valued faculty members, whose many contributions are central to the mission and success of the institution, end quote. 35 additional full women professors and emeriti at Vassar filed a joint statement in support of the suit, saying, quote, the harm women at Vassar have suffered goes beyond the loss in compensation over the many years, in some cases decades, we have served the college. Vassar's repeated failure to remedy the ongoing gender wage gap and the implication that our professional contributions are less meritorious than those of our male counterparts constitutes a profound institutional betrayal, end quote. You can read the full statements and the class action complaint at WAMC.org. Vassar College serves roughly 2,500 students with just over 350 faculty. By way of disclosure, the college is home to WAMC's Hudson Valley Bureau. Thanks for listening to this week's 51%. 51% is a national production of WAMC Northeast Public Radio in Albany, New York. It's produced and hosted by me, Jesse King. Our associate producer is Jody Cowan, and our theme is Lolita by the Albany-based artist Girl Blue. Just a reminder that you can listen to 51% anytime at WAMCpodcasts.org or wherever you get your podcasts. And you can stay in the loop on all of WAMC's shows by signing up for our weekly newsletter, Airwaves, at WAMC.org. We hope you'll join us next week. Until then, I'm Jesse King, 51%.
I was every single girl, I was nobody else, I was so sure of myself. I was 15 and a half, he was a hollow laugh. And I lost my cool somewhere along the way. The nightmare down the hallway, I had to learn how to look away. I lost my cool, no electricity, hot rain on the concrete, sweet melting little girl dreams. They said, oh, I want a big life, not a house I could have been like. Where are you taking me? Where are you taking me?